Hello, this is Angelica at the Osteopathy and Healing Center. I'm so excited today to share with you some examples of using your intuition when you're treating a patient. So I started doing medical intuition, and I informed the patient that I'm taking a course and if they're okay that I use my intuition. And the response is yes. So these are just some examples over the last month and a half to 2 months of some examples that may help you to use your intuition when it comes to getting information from the body. So the first example I want to share with you, I was doing a Reiki session with a patient, and with Reiki what you do is you work on the different chakras of the body, and I was working on the throat chakra. When I got to the throat chakra and I had my hands there, I picked up that there was problem with this patient speaking up to his dad, and also that there was tension within the family, mom being hard on the dad and the son in terms of expecting lots from them, more so from the dad than the son, and then the son internalizing it and acting out in terms of exams to do really well. So how did this come to me? I saw images and I felt the emotions. If you remember in the previous video, we talked about different ways that you can pick up intuitive information, and one of them is kinesthetic awareness, or being able to pick up also emotions and images. And again, I heard now a voice. So remember, when you're doing intuition, you want to distinguish where the source is coming from. In this case, I heard the mind of the patient say, I want to speak up more, I want to speak up more. And then I got to the small intestine, it was okay. But then I got to the lower side of the abdomen, and I heard again, the source was the mind saying, exams. So that time when kids have exams or teenagers are doing their exams, it was affecting, in this case, the patient's right side of the abdomen. And I got to the pelvic area and I felt there was imbalance there as well. So I'm working on the pelvic chakra, and then an image comes to me, so again visual, of the parents being divorced. The emotion I feel is sadness. And then I feel this love for this patient's parents or mother. And I also feel that there is this strong attachment. I get to the chest, working on the chakra there, and I feel this pressure sensation. So kinesthetically, I'm picking up, I feel this pressure sensation. That's why I was drawn there. So I'm picking up kinesthetically what's going on. And the emotion that is related to that I pick up is grief. That has to do with his mom that needs to still be processed out. So you may pick things up within your body, and that will tell you, go to the small intestine, for example. Go to the right side of the abdomen. Go to the chest. And so I do, and then once I'm there, I intuitively pick up why I'm there, what the body wants to show me. And then I am sending Reiki energy to that area, and then it clears. So the emotion may change from sadness to love, from grief to love, for example. And that's how I know that the job is done and move on to the next area. Now that's when I was doing Reiki, and if you know a little bit about Reiki, you're already trying to be very tuned into picking up intuitive information. And the next example I have was when I was doing an osteopathic manual therapy session, or OMT session. Now during this session, again, I got an image, so visual, of an Eskimo hunting seal, and then I saw a ceremony that this Eskimo was doing. And I stayed with that image for a while, trying to see if there's a message there. And as I'm getting this image, I'm also verbally telling the patient what I'm getting. And I say, the ceremony is for you to be well and to heal. And then I get another image of his mom being happy and content. And this is when I was working on, we call these sutures here, parietal sutures. So I was doing some cranial work, and when I got there, I got that image. Then I got to the belly, and I saw an image of a whale. And this whale had a cut in the belly. And in this image, I was in this image, and I swam up to the whale where the cut was. I put my hands on the whale, and I saw it clearing. I saw it healing this cut. And at the same time, my hands were on the belly, on the chakra in that area of the patient. And I felt it balancing. In the patient, I felt the chakra balancing as I saw this story or this image play out. So another case of mine, because I am more of a kinesthetic person, like my kinesthetic awareness, I would say, is one of the heightened senses I have. So with another patient, I'm doing cranial work. So when you're doing cranial work, you're in a very relaxed state as well. The patient also, it feels relaxed, and the patient may fall asleep as I'm doing cranial work. And so in this case, again, I got to the same area, the parietal area. And when I got there, in my body, I felt this tension from the parietals inside the cranial bowl. And again, I did my technique of working on the parietal area, and I felt kinesthetically within my body the tension release. And then the patient as well verbally acknowledged that they felt the release as well. Another patient of mine, now this was a very interesting experience. It happened before I was coming to work, that I felt a sinus headache, and it was intense. And I normally don't get sinus headaches. I used to get migraine headaches, less now, but the point is, I knew that this wasn't mine. So I thought to myself, well, maybe it's from the patient that I'm going to be seeing. And what you could do in medical intuition is you can set up a body cue so that you feel the kinesthetic symptoms or like awareness come up when you're at work instead of before you're going to work, because I wanted to get ready for work. I didn't want to think about the kinesthetic sensations I was thinking. So, but that's a side note. I started feeling this sinus headache before I came to work, and then when I saw my patient, guess what she had? A sinus headache, and it was severe. So I had this image, again visual, that came to me as I was working on her body, And I had an image of her doing a saline rinse. And I said to her, your body is showing me you doing the saline rinse and that it likes you doing that and wants you to continue doing that. When I saw her afterward, she said that she felt a lot better. And as I was working on her, so I was doing OMT here, I felt that headache, sinus headache, releasing. Now, the sixth example I have, again, kinesthetic, and this time I was working on the brain, and I was working on what's called the occipital lobe, which is back here. And as I got to the occipital lobe, I felt that the tension there, what was happening there, was also affecting the eyes. And I felt this tight band across the frontal bone area. So there was a connection I felt from the occipital lobe affecting those areas. And so I did my OMT work, and then I felt that release kinesthetically within my body, and also the patient confirmed that they felt a release as well. And again, patients, because they feel the release, they're intrigued to know what I found and what I was doing. So I was sharing with this person before I treated them, okay, so I'm working on the occipital lobe, there's a problem here, and I feel the tension radiating to the frontal area and affecting your eyes. And they're like, 100% that's correct, for sure, I'm feeling that as well. Then I treat it, and they're like, now I feel the tension release. So as you're working with people and you pick up intuitively, if you're kinesthetic, these symptoms or these sensations, and then you work with the patient, you'll feel them dissipate within your own body as well. Or sometimes if you just acknowledge, I'm feeling that, for example, there is pain on the sacrum on the right side, and you tell the patient that also helps to dissipate the pain by acknowledging it. That's what I've noticed anyway with my work. So the seventh example I have, okay, so again, I was doing cranial work on a patient, and I was working on the sutures. So the sutures are between the bones and the cranium, and I had an image of helping that suture by imagining that there was like a spacer between the suture that was opening the space. And as I did that, I felt with my hands that the suture was releasing. Okay, so sometimes we just might see kind of like a story or an image playing out in our head of something happening to that area, and then we feel the release, and it's okay. So sometimes you may get something like that. The eighth example. Okay, so this patient, I felt they were overwhelmed. I felt that it was related to work. And then I saw an image of this person sitting at work with their hands in their head. And I told this patient the image I've been seeing and the emotion, feeling overwhelmed. And this came to me as I was working on the frontal area. So I was doing cranial work again, this time focusing on the frontal bone. And so I tell her this, and she's like, yes, I do feel overwhelmed at work. And I also felt the sadness. And when I got to her hip, I got this image that the right side of the TMJ was being affected because she bit something really hard and it affected the jaw. So before I finished the treatment, I treated the hip, then I went to the TMJ and I checked the TMJ, and yes, there was a problem with the TMJ, which stands for temporal mandibular joint. So then I treated that joint as well and sent her off with an exercise to continue to help herself at home. So that may happen. You're working on one area of the body, and then another area of the body is telling you that it needs your attention. So you go there and you check in, and yes, it does need your attention, and you treat it, and then the patient feels better. The 9th example I had, so with this patient, I'm treating his body. I see again an image, so visual, that his wife is happy and she's seeing her son shooting a basketball into the hoop. And I see an image of this patient working at work, and his neck is side bent to the right, rotated to the right. And the body is telling me this position is causing your neck pain. So I relayed the information to the patient, and I said for him to watch out at work to see if they're doing that. And if they are, the best position is to have your head straight aligned. So sometimes we may get an image that will help us to give information about like positional stuff, how they should position their body so that the problem doesn't occur again. And I'll give you one more example here, a 10th example. Yes, this was interesting because it went into a past life. So I'm just doing my osteopathic manual therapy adjustment, and I'm working on, in this case, the patient's heart. And at first I get an image, a visual again, of this patient in the past in a horse carriage. And I see cobblestones, and I see this patient picking up this woman who was wearing this big dress, like 1700s, 1740s England times. And he's riding the country. I can see the moon. And I'm hearing in my head the Moonlight Sonata playing. And the horses get startled. And then I see this person gasping for air, getting a heart attack, and dying. Now, I am working on the heart. We go into a past life where they have a heart attack. And I relay this information as I'm getting the images to the patient. And I am releasing, working on the heart, doing an adjustment, we're treating visceral organs, in this case the heart. And I have a video on that as well, heart manipulation. And I just get this intuitive information of a past life that he had. So sometimes you may also get past life experiences the patient may have that is also contributing to their condition or to their signs and symptoms or to what is going on in their body. So those are just some examples, 10 that I gave you, and there's more examples that I would love to share with you, but I'm gonna stop here because I don't want this video to be too long. And so the next video, what I plan to do is talk about more examples of how you may pick up intuitive information to give you an idea of what happens when you're treating a patient doing OMT, or in this case, some of the cases I was doing Reiki, and how I shared that information with the patients and how that affected the treatment. So I hope you enjoyed that, and I hope you have a good day. Take care. Bye-bye.